The knowledge we have of the human genetic apparatus, our genome, has already helped thousands of people to avoid disastrous diseases. And the use of that information will have a cascading, rippling effect that will affect people's lives in a very substantial way. Knowledge beats ignorance every time.
When I think about the importance of basic research for discovery and the treatment and cure of human illnesses, I like to use the analogy of the tree. If we think about the outcomes of research being the fruit of the tree, unless one has strong roots embedded in fertile soil, which in research I would say is creative, imaginative research, then the products of that research, as exhibited by the fruit of that tree, are going to be directly correlated with what happens at the roots. And without the roots, there's no fruit. And those roots are basic research.
Basic research is our map, and that is, it begins to define where we're going in terms of ultimately our patient care for us as clinicians. And it's absolutely astounding and exhilarating to think that many of the conditions that we've seen over the years will now be able to understand better and then be able to think about intervening on the basis of science. And science for us in basic biology is the end-all and be-all.
In the last 3 years, I would say, I've almost had a born-again feeling about Rochester because it's assumed a leadership that gives me the confidence that it will become a major center of science, and that will reflect very positively on the clinical medicine that's done there and on the health of the community.
We've made the statement that we want to be the academic medical center of the 21st century. On the clinical side, strong Memorial Hospital and our healthcare system, strong health, I think is really the envy of this country amongst academic medical centers. On the research side, we've built a new research building. We're recruiting 100 new scientists. We're going to spend $500 million over the next 10 years on this program. And we want to see at the end of that time that we are in the top 10 to 15 academic medical centers in the United States.
Well, the University of Rochester has a very good reputation among academic medical centers. If you visit the institution, meet with the faculty, look at the facilities, one comes away very impressed.
I can say that on the national level, where I travel a good deal, I hear a lot about Rochester. And it's always fun to be able to be a representative of this institution because the leadership that we have here has been prophetic in understanding that what we needed to do was to continue to reach for excellence and that we really needed to rethink the direction in which we were going.
I really see the growth in Rochester as being the University of Rochester, this medical center, and the great academic programs that are involved.
The jobs that are created here in Rochester are very high-profile jobs and great jobs which spur the whole economy. Rochester is on a resurgence of growth, and the research center is the integral part of that story.
This is the wave of the future for Rochester. It is a fast-growing industry, and in my opinion, it's the industry that will rejuvenate Rochester.
If you think research is expensive, try disease. And we may spend these billions of dollars in basic research and clinical research, but that still is 1% of the trillions of dollars we spend on disease. And there's no better investment that a nation can make. Industry makes it all the time to expand the knowledge base such that the product will be more effective. And I'm speaking now of the knowledge base in science that will make medical care cost-effective and more easily available.
Much of what we do is to make a small investment and hope that there'll be what we call a ripple effect, that many things will happen with that small investment. When I talk about things, I'm talking about investment for new knowledge, I'm talking about investment for better patient services, I'm talking about investment in the next generation of the young people whom we train. And what's astounding for people at my stage in terms of our careers is to think that the investments made today in a center such as ours will have lifelong implications, not only in terms of our understanding better about the disease processes, but also in terms of better health for our patients and greater and healthier lives, but also that the physicians and the nurses whom we train will have ever better information. So an investment potentially can then have a ripple effect and can be seen over the ages to really make a difference.
Thank you.